Did you know that Indigenous Australians have shorter life expectancy and worse health outcomes than those of non-Indigenous Australians? Before we delve further, let's take a look at the historical factors and events that have impacted the lives of Indigenous Australians and affected their health. First off, 1788, the beginning of white settlement. The British colonists arrive and take land under the premise that it belongs to no one, when in fact the land had been previously occupied by Indigenous Australians for over 40,000 years. Next, the 1880s, the Indigenous Australians that survived the years of war were put onto reserves and missions, thus beginning segregation. There were even particular laws put in place to control the relations between non-Indigenous and Indigenous Australians. In 1910, Aboriginal children began to be taken from their homes and their families, boys and girls sent to farms, to missions, to work without education and often exploited. This was known as the Stolen Generation and lasted for up to 60 years. The effects on Aboriginal families was devastating. Next comes the Assimilation Policy, 1937. The aim of the Assimilation Policy was to rid the Aboriginal problem gradually by conforming the Aboriginals into a wider community so that they would lose their identity and their culture. It wasn't even until 1967 that Aboriginals were given citizenship in Australia. The loss of land, colonisation, loss of culture, loss of identity have all significantly impacted Indigenous Australians' physical, mental, emotional, cultural well-being, not to mention affecting their income, their education, employment issues, health, distrust of government, and as mentioned before, life expectancy.
Racial discrimination, poor health, access to health service, limited levels of education are the issues of Indigenous health well-being. The Indigenous Australians are in need for improvement on their everyday living standards, life quality. Nowadays, they are highly experiencing low income and standard of living, including poor quality and community infrastructure, results in poorer outcome in health. In fact, Indigenous Australians go to hospital at a higher rate than non-Indigenous Australian, which means like 2.5 times more than non-Indigenous people. Furthermore, discrimination and racism over the Indigenous is a big issue. There are needs for cultural acceptance. To increase health accessibility for Indigenous Australians, they need more health department, particularly in rural areas. In fact, 26% of Indigenous Australians who live in rural areas experience 40% of health gaps of Indigenous Australians overall. Their needs for equalities in healthcare access, service provisions, and health outcome. There are many Aboriginal Australians still facing limited access in services and imbalanced power relation costs. Therefore, to enhance Indigenous Australian health well-being, skills and strategies clinical and professional can apply to meet their health needs include 1. Reduce inequalities in the healthcare access and improve the quality and effectiveness of care of Indigenous people. This strategy is also known as cultural competency. 2. Set behavioral attitudes and policy that encourage system, agents, and professionals to work effectively with them. 3. Develop cultural competence in health service by focus on knowledge, awareness, behavioral skills, and attitudes on all levels of service. 4. Provide healthcare education for students. This can improve health students for preparedness for working in Indigenous health in their future commitments for working change. This also leads to open attitudes, a better understanding of Indigenous health issues, and increased awareness to engage with Indigenous.
Okay, question 3, the experiences of Indigenous Australians when they use health services. So according to the Australian Institute of Health and Welfare, it's a known fact that Indigenous Australians are less likely to access health services compared to non-Indigenous Australians. In 2008, Indigenous Australians reported problems accessing healthcare services, such as long waiting lists, even the cost of healthcare itself. Barriers to accessing these services include obviously language barriers, transport, obviously money is a big issue, as I mentioned before, lack of communication and understanding, like I mentioned, technology, and even the internet. Now, getting lack of these services for Indigenous Australians can obviously affect health outcomes and quality of life. Now, one study found that there are reports of racism being involved when it comes to treating this population group. For example, an Australian doctor or a physiotherapist or another allied health professional treating a an Indigenous Australian found that there can be racism involved because they might not provide the standard quality of care, or they might make remarks that might be seen discrimination or prejudice and so on. This can then affect the social determinants of health, especially the social aspect. So Indigenous Australians might not want to meet new friends or new people. Therefore, it affects their health, their well-being, their mental health, their physical health even. And that's a very important factor. So these are the experiences that that Indigenous Australians are experiencing when accessing healthcare services. It can affect their whole life. And many Indigenous Australians live in remote and rural areas, and therefore accessing these mainstream services can be quite difficult. Now, this leads on to another issue, which means it can affect their mental health, which therefore can affect their overall well-being. Okay, question 4, the health needs of Middle Eastern people in Australia, which is our population group. So according to our Wellness Group report, there are health inequalities among many different population groups in Australia. It's also reported in that report that people that are born overseas, such as Middle Eastern people that migrate to Australia, are hospitalised at a much higher rate compared to Australians that are born in Australia due to chronic conditions and so on, because they are obviously more prone to those chronic conditions. Also reported that migrants from Middle Eastern continents there that migrate to Australia with low education levels can find it very difficult to find a job, employment, go to school. So that's another key factor in terms of a health need, and therefore that affects their overall health. It's important to note also that education and money also affect health, and these are known as the social determinants of health. We know that in health that medical factors are not the only factors that contribute to health, like preventing illnesses. We know that there are social determinants of health that affect our health. It's important to address these non-medical factors so that people can live a fulfilled and balanced life. Now, if we talk about chronic conditions, diabetes is very high in Middle Eastern people from that sector compared to the Australian-born population. Now, this is very significant from an economic point of view because it's costing the Australian healthcare system a lot of money, billions of dollars. And so that's very significant, and that's a health need that needs to be filled. Young people living in Australia, young Middle Eastern people living in Australia, also face enormous challenges, opportunities, and changes. And this can affect their health. For example, they might choose to stick to their own culture or merge to another culture, and this can be a health gap, and it could identify a health need in check when they grow up, for example. And once again, health needs are affected here because we're talking about medical factors like diabetes that was mentioned before, and non-medical factors like education and money, which is very relevant to Middle Eastern people living in Australia or that are going to migrate to Australia.